Okay, thank you, and good morning. So my name's Phil Jennings. I'm a primary care doctor, a GP, from the northwest of England, just near Liverpool. And what I've been asked today is to give you an overview of how the NHS operates. I'll be talking about England specifically. I've got about 15 minutes, so I could talk all day and all night, and probably some more about this, because the system is quite complex. So what I'll be presenting today is quite a simplified overview, and there's quite a lot I've missed out on purpose, but hopefully it'll be enough to give you an idea of the scale and the context of how the health system in England operates. So I thought I would start by describing the different sectors of care within England and how they're accessed. So starting at the bottom here, you can see the patient. And broadly speaking, we separate our system into primary care and secondary care. So primary care involves GPs, so family doctors, but it also involves dentists, pharmacists, and opticians, albeit today I'm talking really only about GPs or family doctors. And most of the activity within the NHS actually occurs in primary care. So we have a situation, we have the bulk of the activity occurring in one sector, albeit the bulk of the funding is taken up by other sectors. And as you can see from the slide here, we perform 340 million consultations in primary care each year. So that means for the average person in England, they see their GP about 6 times a year. Some of my patients see me 60 times a year, but on average it's about 6 times a year. And GPs are organised into practices, and there are about 7,500 GP practices in England. GPs are often called the gatekeepers in the NHS, so we perform the primary triage service for patients presenting to NHS services. So it'll be a GP who will decide whether or not a referral is necessary into secondary care or an acute admission into hospital. If you don't see your GP, you can present to unplanned care services, and generally speaking that's what we call the accident and emergency departments, or which are the same as the emergency rooms. It was a different name. And overall you can see that we see about 23.5 million patients in the emergency room or accident and emergency department each year. But you'll notice only just over 4 million of those are actually admitted to hospital. So there's a large number of patients who present and are either treated there and then or redirected to other care, which again raises the question as to whether or not that part of the system is operating as efficiently and as well as it could do. You'll see that from those 4 million admissions into hospital, we have about 134 what I've called here acute trusts. So they're hospitals in England which perform the full range of general medical services. And that's separate to another 34 mental health trusts. And we have about 130,000 beds in the NHS in the English system, which overall are about 89% occupied at any given time. We perform about 113 million outpatient appointments, of which only 89 million are attended. Again, that's an issue for us. And in total, we perform about 10 million surgical procedures, and that includes from the very minor joint injections right the way up to transplant surgery. Also within the system we have some specialist hospitals. So you can see here I've said there are 17 specialist trusts, and in this regard I'm talking about hospitals that serve just a small section of the population. So specialist children's hospitals, so you may have heard of Great Ormond Street in London or Alder Hey in Liverpool, or dedicated neurosurgical or cardiothoracic centres. And that system's then supported by 10 ambulance trusts, 35 community providers who provide district nursing, physiotherapy, occupational therapy, and then a large number of independent organisations, so that's the charity sector, hospices and others who all provide patient-facing services to the NHS. So quite a spread, quite a lot of activity. £110 billion a year is the NHS budget in England, so not an inconsiderable amount of money that we spend each year on the health of our population. So moving on, I'll just try and describe how healthcare is commissioned. So in England we talk about commissioners and providers. So by commissioners we mean those people who hold the budgets and are responsible for determining what the health need is in their geographical area and buying in services to support that. So the primary unit of commissioning in England is the CCG, or Clinical Commissioning Group, and they are formed of the GP practices, the 7,000 that I showed you before, within a geographical area that come together to form a CCG. And it's the GPs within that group that sit on the board. We call the board a governing body, and it's that governing body that determines how the health resource is spent within the geographical area. So on average, a CCG will serve a population of about 250,000 people in England. Again, there's quite a variation there, anywhere from about 80,000 right the way up to 850,000. And the CCG is responsible for commissioning most of the hospital care, so the planned outpatient care, A&E departments, most of the medical and surgical specialities. They also commission community care, so district nurses, podiatry, physiotherapy, mental health care, so both community mental health care and secondary mental health care. And then finally also primary care, albeit it's just the GP component of primary care. The other things that I mentioned earlier are commissioned by NHS England. And then elsewhere in the system there are other commissioning bodies. So NHS England, which is a national body, is responsible for specialist services, so things like cardiothoracic surgery, transplant surgery, paediatric oncology, so low volume, high cost, very specialised interventions. And NHS England is also responsible for commissioning services within our prison population and also within our armed forces. And then finally here I mentioned public health, which is involved with the commissioning of immunisations and the screening programme. So in England the big screening programmes are bowel, breast and cervical screening, and that sits with public health. Now, moving forward, within the last year, there's a new body that has arisen, which are called STPs. Unfortunately, you'll find the NHS is full of acronyms. So an STP is a Sustainability and Transformation Partnership. It was called a plan initially, but now they're called partnerships. And there are 44 of those in England, so they are for larger footprints. This time on average about 1.2 million patients, but they can be as large as 2.8 million in some cases. And really STPs are there to try and do the tricky things that CCGs haven't been able to do. So they're involved largely with reconfiguration of health services. So again, in England, the health services evolved in such a way that we've had lots of small hospitals that have offered every service to begin with. But increasingly, we've come to recognise that that's not sustainable moving forward. And so reconfiguration is bringing patients and services into specialist centres where they can perform high volume of work with specialist teams who can operate 24/7. Unfortunately, what that means is that some local hospitals, either the hospitals or their departments, will need to close. And as the NHS is a tax-funded system, that does create some political tension, and certainly closing anything in the NHS is a very difficult thing to do. And STPs will also hopefully provide the leadership to drive this change. So again, there's only a very few number of individuals who've got the skills and the experience to lead this kind of change. And by concentrating that talent within STPs, we hope that they will be able to move us forward in the years to come. So finally, you heard that I'm part of something called an academic health science network, which is also part of the NHS, but with a different remit. So we've got a very proud heritage of research and discovery in the UK. So antibiotics, asepsis, the structure of DNA. So we're very good at inventing things, but what we're not very good at is commercializing things or spread and adoption. So that in fact, it takes up to 13 years for a product to go from the discovery stage to be either on a hospital ward or on the desk of a GP, and clearly that's just not acceptable. So the broad remit of academic health science networks is to accelerate that process, and we act as a link between research, academia, and the front line of the NHS. And we're there to build those bridges and hopefully get new innovation employed into clinical practice as quickly as we can. So thanks for listening to me. I appreciate that's a very brief overview, but I'm more than happy to speak with you later with any queries.